Dr. Nicholas Mercer with You Improved PT. There's something going around. It is knee pain. And specifically, patellofemoral knee pain. And that's pain that you may get right on the kneecap or below the kneecap or even just above the kneecap on either the patellar, what I refer to as the patellar ligament, the patella, and the patellar tendon up through here. So why do we get this knee pain that kind of centers around the kneecap? Well, for most people, it's because they're quad dominant, right? So whatever their activity may be, whether it be weightlifting, general exercise, martial arts, or whatever they enjoy, even just walking, it's because for some reason their quads want to take over. So the quadriceps muscles are the muscles on the front of your leg, and they are responsible for extending the knee. Except for one of them, the rectus femoris, it helps extend the knee, but it also flexes the hip. And in a lot of people, this is the muscle that is the main culprit in this kind of central patellar pain. And the reason for that is whenever a muscle is in control over two different joints, it can get a little hyperactive. By that I mean it works overtime in order to stabilize two different joints and be a mover for those joints. When a muscle is hyperactive, those nerves constantly are turning on and off the muscle, and sometimes they just spasm. They get so used to making that muscle contract that they spasm, and it makes it incredibly difficult to allow that muscle to relax. Over time, that spasm will actually decrease some of the blood flow, and then that causes it to spasm more, and then you have this back and forth of this vicious cycle, really, that just increases those symptoms whenever you're trying to activate that muscle and control your hip and your knee. So what can we do in order to kind of modulate this spasm in order to manage this pain? The first thing you're going to want to do is get your hands or massage tool into those muscles. I would say spend some time on all of the quadriceps muscles, but really focus in on the rectus femoris, which is going to start from the anterior inferior iliac spine, right around your hip, and it actually ends past your patella, right into your shin where you feel that little bone on the bottom. As mentioned before, this is the muscle that usually gets most in spasm, but we want to make sure we cover all of our bases in order to make sure we really get that pain relief and management in the knee. The next thing you'll want to do after we help break that spasm cycle with the soft tissue mobilization is the Quadricep Stretch. And this one is actually more specific for the rectus femoris because that's going to be the muscle that stretches the most. It crosses two joints. It has more potential to be stretched. So what you're going to do, you're going to start next to a wall. And I would suggest that you have something that is soft, maybe a pillow or a foam pad. Get your knee as close to the wall as you can. And then bring the other leg up so it's supporting you. So you're kind of in this half kneeling position. And you're actually going to turn your body towards the leg that's up, bring the foot of the leg that's down onto the wall, and you're going to push the hip, right? So the hip of the leg that's down is going to push forward. You're going to feel those glutes contract, and you should feel a stretch on the front of your hip. In the front of your hip, you may feel it on the entire front of your leg. That's okay. That just means your quadriceps were really, really overactive and restricted. Over time, you want to make sure that you're slowly increasing how tall you can get, but you're probably going to start with your chest almost at your knee and your hands on the ground, and you might be crying a little bit because this isn't necessarily comfortable. You should feel mostly a stretch, not really pain. Another thing to remember is we don't want to arch our back. So if you notice that you're breaking your back and you're extending backwards, that shows that you're compensating. You are trying to get movement in your hips, but you're actually getting it from your lower back. And we don't want to cheat ourselves out of a good stretch because our goal isn't to look really cool when we're stretching. The goal is not to attain a position. The goal here is to stretch a muscle. So if you're not feeling that stretch properly, you're defeating the purpose, and that knee pain is not going to improve. So avoid arching your back and make sure that those posterior hip muscles, the glutes, are active. We should be kind of lightly squeezing our booty throughout the whole thing, driving the hip forward. Now, you may consider, I could do this standing, right? All I have to do is grab my ankle and pull the leg back. And ideally, yes, that would be a thing that you could do. However, that's not going to get enough stretch on the rectus femoris. The reason for that is if your leg is an open chain, which basically means it's not attached to the floor, you are way more likely to extend from your back and not notice it. In addition, when you're standing straight up, your opposite leg is actually in neutral, and that encourages the pelvis to tip forward a little bit more than you would had you done the rectus femoris stretch against the wall. You see, when we are on the ground in this kneeling position and we have the opposite leg up, it encourages a more pelvic tilt of the pelvis. So having that opposite leg up is actually helping us lock in the pelvis so that we can get the appropriate stretch in the hip. So really important to make sure that we are doing this exercise properly, we're doing the stretch properly, and we're not trying to just do it in standing because it's convenient, because it's not going to work as well. And ultimately, this quad dominance that is causing the restriction in these muscles and ultimately causing your knee pain doesn't just happen, right? It's not just because you overworked it necessarily. A lot of times there's an imbalance somewhere else on the chain, whether that be your ankle, your foot, even your hip, your lower back. If certain muscles aren't strong, certain muscles aren't mobile, it's actually going to cause your body to put more stress and strain onto those quadriceps more than is really needed. It's going to make them more active than they need to be, and it's just going to encourage that spasm again. However, everyone's a little different, so it's hard to pinpoint exactly what's going on. But if you would like to talk about that and get a start on fixing all of your problems upstream and fixing the root cause of your knee pain, go ahead and go to youimprovept.com. There we have a lot of free tips and strategies on how to alleviate and ultimately end knee pain for good. Download the free tips report for ending knee pain, and let us know if you have any questions. We're here to help you. Send us an email or give us a call. We'd love to have a free phone consult or free discovery visit with you and finally get down to the root cause of your knee pain. All right, so thanks for watching this video. Please make sure to subscribe to our YouTube channel so you can continue getting videos like this to help improve your movement and improve your life.